Hey everybody, Montel here, and welcome to Free Thinking with Montel. And thank you so much for joining us today. I've got an incredible guest with us today, Dr. Babak Kateb, who is a neuroscientist with more than 20 years of research experience. His research has been focused on introduction of advanced diagnostics and therapeutics into clinical neuroscience in order to rapidly identify and introduce game-changing technologies to treat neurological disorders such as brain cancer, Alzheimer's, Parkinson's disease, and other brain and spinal cord disorders. Dr. Kateb established the Society for Brain Mapping and Therapeutics while doing his research fellowship 15 years ago at USC, and currently serves as the organization's chairman of the board of directors. He's also the president and scientific director of the Brain Mapping Foundation and director of the National Center for Nanobioelectronics. The center is focused on integration of nanotechnology, cellular therapeutics / stem cell, and medical service and imaging. He's also the director of the Brain Technology and Innovation Park and CEO of Smart Microscopy, Inc. He's also, believe it or not, got a little bit of time on his hand to every now and then run a marathon, which he's run 15 of, and he's an artist who paints and does some medical illustrations for medical textbooks. Dr. Kateb, thank you so much for being here with us today.
Pleasure. It's an honor to be here with you, with inspiring, legendary Montel Williams.
Oh no, thank you, sir. I'm really. I think we've talked before. A lot of people, my viewers and listeners, don't know that I've been involved in research dealing with brain, from traumatic brain injury to MS to neurological disorder now for about 10 years. And have been working recently on pushing forward some brand new breakthrough initiatives in psychological help and in psychological therapy for PTSD. And I hope we get a chance to talk a little bit about that before the end of the hour. But I wanted to start off by first saying that you have really been just busting your butt. That's the only way I can explain it. In the last 6 months, being a part of this whole COVID-19 pandemic. And this has touched your family personally. First off, why don't you explain how it's touched your family personally and how you've been involved? And I've got another big question for you. Well, I'll finish it. The other question is, how today can people deny that this pandemic still exists? I was looking at the news yesterday and was blown away when a politician stepped up to the microphone and had this nerve to discuss COVID-19 as if it's in the past. And COVID-19 is very much still here. We just broke under 1,000 deaths a day this last week. So has it affected your family personally? Number two, where do you think we are right this minute, and how can people deny this truth?
Sure. Well, thank you very much for giving me an opportunity to be on your show and speak to your amazing viewers. Well, obviously, we all got impacted by COVID-19 when it was announced out of Wuhan back in 2019. But immediately after we received the sequence of the virus from Wuhan, we created a global task force of scientists of different backgrounds: infectious disease, neurologists, neurosurgeons, spine surgeons, and basically molecular biologists and so on. And they had weekly calls and discussions of scientific papers, new treatments, and so on. So fast forward 6 months after, actually 8 months after, we published the most comprehensive review of COVID-19, from etiology to pathophysiology, all vaccine, treatments, nutrition, and rehabilitation of this disease in the Journal of Alzheimer's, which is coming up in September. So it's kind of a landmark review because, as I said, we spend months and months every day to review all the papers and articles that came out. Over 1,000 papers were reviewed, 425 of them referenced, and pretty rock solid, review that's coming out in Journal of Alzheimer's Disease. Now, how that disease impacted me, unfortunately, my mother got sick of COVID-19. She was on dialysis as a dialysis patient and got it in dialysis center, and also transferred that to my father, and now we know through my sister. She ended up being hospitalized at Cedars-Sinai Medical Center, and I should just truly thank the nurses and medical staff at Cedars-Sinai for basically saving her life. So we had 25 doctors of different disciplines working on her. The main doctor was Dr. Payam Shadi, which I thank him for that. And basically, we got or stabilized, but she almost died 3 times on all types of complications. So she developed ARDS, acute respiratory disease syndrome, and then after that she had cytokine storm, and after that she had what's called acute coagulable state, which basically your body starts forming thrombosis and emboli. So she had a emboli in her thrombosis in her abdominal wall, and then she had emboli in her lung, and she had 2 thrombosis in her arm. Almost pushed us to actually, think about the worst, amputating her arm, because her arm was so swollen that the skin would come to the level that kind of ripped. So, but the most important thing is that the team was spot on. I mean, the Cedars-Sinai team was just absolutely incredible to check her status with me, and she developed a mild sepsis. These patients develop sepsis after the virus left. So you've got to be very careful, block that, because they can quickly die of sepsis. So we quickly blocked that, and then so we basically got her stabilized, and then from there we moved her to California Rehabilitation Institute. It's a Cedars-Sinai UCLA institute, and basically we had to deal with her another condition, which is called autonomic dysfunction, because when you're lying on the bed for so many months, your autonomic nervous system is going out of whack. So basically, you can't stand up and walk around. So you get dizzy, and the blood pressure goes up and down. So we had to deal with that, and finally, after 63 days, 2 days before my birthday, in July 13th, 12th actually, my birthday is on the Bastille Day, 14th of July. She was released from the hospital, and she's recovering now. My father was an 86-year-old with basically history of lung issues and asthma. He was a heavy smoker until his 50s, and one day quit and basically never smoked again. But that's developed developed into asthma, and he had COVID-19. He tested and was positive with no signs, and just recently he's developing this kind of rash that appeared all over his body, and we kept testing ourselves. I mean, I was negative all the way, but my sister was also negative. She just got an immunoglobulin G assessment. It turns out that she developed immunity for COVID-19. Now, we don't know how long that's going to last, but this tells you a story about how a family could be infected. One has no symptoms, one has questionable symptoms, the other one goes basically um, deals with complete organ destructions and kind of symptoms and almost death.
This is crazy, though. I just can't believe, though, still we're now into this for 6 months, and there are people out here who still don't think this is real, or now people think this is behind us. Is this really behind us, doctor?
It's not. And it's real because last night I got a text from a friend saying that this is a bioweapon
Mm.
that dates and some people are supporting this research. Look, we always do research on deadly disorders and deadly diseases. That has been the goal of National Institute of Health and National Institute of Infectious Disease. So I think if you look at how we come up with a drug for this COVID-19, which is remdesivir, you will see the history of our research on Ebola. Remdesivir was a drug of choice for Ebola. And so we repurposed that to COVID-19. So to say, NIH was doing research on these coronaviruses and funding this type of scientists, mad scientists, and develop something, that's not true. You always go after the most deadliest viruses to understand them and basically preemptively develop drugs and technologies to basically use them when you need it. So that's, kind of answer to the question that this does not seem to be weaponized virus, because if you look at the sequence and compare that with the other sequences of the virus, the coronaviruses, it's very similar. Now, it has mutated as any other virus does. It has 7 basically new strains, which has made it more infectious, so it can spread faster, but doesn't seem to be make it more deadly. So that's that. Now, some people don't believe this COVID-19 exists. I mean, um,
And that's like some people believe in
that the Earth is flat. So,
yes.
but if there are, and to be frank with you, I'm appalled to see some of the doctors uh, say, such kind of an inappropriate comments, knowing their background and their education. Now, the politicians say this is gone away, or they want to think or live in a different reality to just kind of look the other way, thinking that if I don't see it, doesn't exist. We see a lot of casualties of this disease. The same politicians compare this to flu. Same politicians said, 36,000 people die of flu. So what? This is just, 10,000 casualties. Now we are in 180,000. And also, by the way, we don't know the secondary impact of this disease. COVID-19 could cause cancer. Yes or no? We don't know. COVID-19 now we know can cause stroke and can cause meningitis and other, encephalitis. And this was listed in our paper. So we are learning as we go, but we can't play a Russian roulette with our lives and, kind of say, the death toll on this is okay, less than 2%. Okay, let everything open up. Let's everything go about the same way it was. We've got to. We are Americans. We think differently. We are on the front line of science, and we do more testing than any other nation. I agree with that, and we report better than any other nation. So, I mean, I trust our data because there are so many oversights on the U.S. data. So, to be frank with you, we are the nation that is reporting honestly and testing rigorously, uh, and we are the nation which come which will come up with new drugs and vaccines for this.
Let me ask you a question now. Do you get to work with or talk to, the task force at the White House, or do they ignore the science that you guys want to provide to them?
Well, indirectly, we're discussing as our papers coming up, be communicating with them. But I mean, I think um, there is a learning curve to be fair. Um, there's a learning curve in this disease across the board. White House, NIH, all of the scientists, and the boys will learn that. In terms of clinical protocols, how to treat these patients, you're lagging behind. I think what CDC has to do, is they have not done, come up with a protocol that says um, you have to do X, Y, and Z when you see these patients. Okay, for example, when you see a brain cancer patient in the ER, okay, automatically you have certain protocol to go through in your mind. So, what does COVID-19 means to you? Okay, COVID-19 to me, if somebody tells me my patient has COVID-19 based on this paper that we wrote, I'm going to think about, okay, is he or she symptomatic or not? If yes, okay, then what are the symptoms? Severe or mild or moderate? Severe, okay. Symptoms are severe, then I'm going to think about, predict what's going to be happening. If the symptoms are severe, I'm going to watch for ARDS, okay, acute respiratory stress disorder. And then I'm going to also predict this patient going to get cytokine storm. I'm going to predict this patient going to have acute hypercoagulable state. And then I'm going to think about, okay, this patient going to have sepsis. And then I'm going to think about in the rehab, this patient is going to have basically autonomic dysfunction. To me, a severe COVID-19 means these 5 things that I mentioned. So
And so far, wait a minute, but now, and so far, we haven't established that protocol or that guideline yet. So literally, we have in 50 states, 50 sets of doctors going about this 50 different ways. And I'm sorry, and probably 100 different hospitals in every single state. So, that seems to me just a dumb way to do this. And I don't understand, why hasn't the AMA, haven't doctors stepped up to the plate and said, wait, stop, guys, let's put this in the same protocol and format that we've put any other disease? Why have we not done that?
I think because there was not a single comprehensive review on the disease so far. Most medical journals have word limitation, table of research limitation, or image limitation. So when we approached Journal of Alzheimer's disease, they were gracious to us to allow us to present the comprehensive review, because these reviews, going through thousands of papers, help us develop guidelines based on science. So the Society for Brain Mapping and Therapeutic going to do that, and I think we're going to share this review with the White House Task Force and Dr. Fauci, and because we also look into the therapeutics, like the remdesivir, that is basically blocking the replication of virus. send an image to your producer that you could show that basically the mode of entry of virus to the cell, it is through a ACE2 receptor. ACE2 receptor uh, basically play a significant role, and when the virus is inside the cell, basically it has to replicate itself. And drugs like remdesivir and also Avigan, which is Fujifilm in Japan produced it, are blocking very well that um, replication and basically stabilizing the situation. So the virus cannot reproduce itself and infect other cells.
So
So you
that limits the viral load inside of someone's body. Now the Society for Brain Mapping just completed this comprehensive report, and has it already been published, or you're trying to get it published?
no, it's accepted for publication. Is in the press. I send a copy of that to you, and it is going to be in I think volume 77, number 2, September 2020, Journal of Alzheimer's.
Mhm.
And it will be highlighted. This went through. Uh, we went through a lot to publish this paper because the reviewers, made sure that we basically on the solid ground of the science,
Right, crossed
including
every I said crossed every
including
T and dotted every I, right?
yeah, sure, and including I mean, one of them had about 68 points that we had to respond. One of the 3 reviewers. So altogether, probably we responded to about 200 comments on the review, uh, and we basically addressed those. But one of the topics that we discuss is obviously does hydroxychloroquine help?
Oh,
And going back to the same picture that I sent to you, if you show that to your viewers, you will see there are 2 different pathways that coronaviruses actually infect a cell. One pathway is ACE2 receptor, as I mentioned. The other way is endocytosis. Basically, the virus will be gobbled up by cell wall. So the hydroxychloroquine basically impacts that endocytosis. Uh, but uh, but endocytosis doesn't really happen in COVID-19. Okay, so that endocytosis is not happening in COVID-19. Therefore, um, the hydroxychloroquine, by definition of molecular biology, is not going to be helpful. Now, there was a study done by Henry Ford saying that hydroxychloroquine works, but in that study they also use steroids. That's not a double blind, okay?
right.
So, and now we know steroids will help. So, I mean, I think there is a great need for paying attention to science. Science has been ignored, and unfortunately, um, in our schools, high schools, universities, science also are put on the back burner. We don't teach science to our middle schools and high schoolers properly because a variety of different reasons. We get mixed up with religious and kind of a political thinking. The beauty of teaching science to kids is that they develop an inquisitive mind. Okay, they look at the facts, red or black, or just look at the facts. And currently, we are living in a society that even uh, doctors who crave for media attention, they come and say complete nonsense. That are like some of these doctors who were in Washington, D.C., talking about one of them, the lady was talking about, treating her patients with hydroxychloroquine. She doesn't even have a single publication on that.
Right. And
So
that's because
I
now
can treat you with water and you get better and say, oh, well, yeah, water is a medicine and bottle it and sell it to you for COVID-19. That doesn't work in science. Okay. You've got to have a control. You have to go, and that's what Dr. Fauci has been saying. You can't just pull a treatment out of a hat and say, oh, anecdotally, my uncle and my mother and this and that got better, so this is perfect. Or I've been taking hydroxychloroquine. That's like President said. I haven't gotten it. Well, maybe you did not get exposed to it. Maybe you're. I'm sure that's the case. I mean, he's a president, he's been kind of secured. So to get politicians into um, suggesting treatment is just irresponsible.
absolutely irresponsible. Look, doctor, I have to do a little thing. I got to pay a couple bills, so I got to take a little break, and that break will be just a minute. And I know you've been listening right now to our podcast, and you're from Free Thinking, and literally, I can't thank you enough for being a part of today's discussion. I want all of our listeners to make sure you stay tuned. We're going to go away for about 30 seconds and come back after we pay some bills. And you've been listening to Dr. Babak Kateb, who's a neuroscientist and runs and is the president of and the chairman of the board of the Society for Brain Mapping, that's been doing a lot of research into and doing a lot of studying and trying to make sure the facts get published on COVID-19. So you don't want to miss what we got coming on. Yeah, next, we're going to take a little break. We'll be back right after this. Well, hey guys, welcome back to Free Thinking with Montel. And again, our guest today is world-renowned neuroscientist and investigator and therapeutic investigator and the president of the Brain Mapping Society, Dr. Babak Kateb. Thanks so much, doctor, for being here with us today.
My pleasure, Montel. It's a great honor to be with you.
Absolutely. And I can't thank you enough for actually, giving out the real true data that needs to be given out right now. I find it just an abomination looking at some of these political rallies where there are still people sitting shoulder to shoulder, not wearing masks, and believing that what politicians say are true, that the worst of COVID-19 is behind us. I don't want you to put on a crystal ball, but if you had a crystal ball for a second, everybody's been talking about how much worse this is going to get in the fall. What's your prediction for the next couple of months? We're at 180,000, I think 180,000 deaths as of today. How bad can this get, sir?
Well, I mean, I think going back to your initial point about politicians thinking that this is going to go away, it's not going to go away. Unfortunately, this is going to be around like HIV/AIDS. You have to live with it, and it's just a simple math you have to do to see when you have a flu season, your casualty of flu going to go up. Combine that with COVID-19, unfortunately, we are up for a rough ride ahead. Now, how do we prevent that? You don't have to take hydroxychloroquine or chemical or toxins to protect yourself. Put your mask on. Very simple. Very simple preventive measure that could actually prevent. It's not a political statement. Is basically, preventing yourself to get sick or to transmit sickness to others. So, I mean, that's basic thing people have to do. Now, you have to also physically distance, not necessarily socially. I don't agree with the social distancing. I agree with the physical distance. So socially, you have to be connected to each other, and humans are social animals, I would say. So, but I think there are therapies coming up. There are a number of vaccines coming up. Russia announced their vaccine, they're in phase 2, but vaccine in phase 2 doesn't count. If that's the case, we have like 20 of them in the US. Okay. It has to be in phase 3. So when you go through the phases of trials, you want to see if this is safe, is it feasible, and is it basically um, um, reproducible. The results are reproducible, so you don't have any side effects. Okay, so
So let me ask you, I'm sorry, I'll stop you right there for just a second because as we're talking about vaccines coming, and we'll come back to that. But I want to address a little bit, you just said it. Socially, we are social animals. That's the reason why so many people are trying to, and so many politicians are trying to force schools to reopen to allow children to get back to school so they can do, what they need to do to learn how to socially develop and interact with other human beings. But can you explain how COVID-19 affects children and adults differently? Give us some definitive science behind how, and when I say children, we're talking children in multiple groups, 1 to 6, 6 to 12, 12 and above to
mhm.
18 are 3 different groups affected 3 different ways. Is that not right?
Well, when you're looking at COVID-19, you have to look at it from the virology standpoint. What are we dealing with? We're dealing with a nanoparticle that has a spike protein that can infect. So some studies show that in some adults you don't, or in children you don't have the concentration of ACE2 receptor that allows this virus to infect, and that goes up as we become more mature. So it's really come down to the molecular biology, not the sociology aspects of this. So we've got to see how this COVID-19 reacts in different population. As I said, for my own mother, 81-year-old, she ended up in hospital, almost died. But my 86-year-old father had it and no symptom. And then my sister, always negative, but then IgG came positive. So I think children are, or at least at this moment, seem to be more immune, and there's a reason for that because they have been vaccinated for different things. Okay, so their immune system is hyper alert. And also, there are some studies that shows that the amount of H2 receptor in them is lower than basically adults. Okay, so adults meaning high school and above. Okay, so we are basically paying attention to the molecular biology of the cell in children, but also some of these children have pre-existing conditions, so that put them in risk. Obese children or obese adults, higher risk. So I think we have to have a protocol that allows the students to learn. First of all, if they want to go to school, they can sign up. If they want to learn online, they can sign up. And then they have to get a clearance from their doctors if they have any pre-existing condition.
So let me ask you,
Because
but now the younger child that doesn't have the same amount of, it was H1 receptors, you said?
H2,
H2.
H2.
So the younger child that doesn't have the same amount of H2 receptors, can they still have the viral load in their sinuses and be able to transmit that virus?
Hypothetically possible, and those are things that are being studied as we speak. And basically, that's why the science has to drive this, okay? Not kind of a political movements, close or not close. I mean, in some areas you don't have as much as infection, so you have to basically look at the infection rate in the population, and then with proper social distancing, maybe you could have some physical attendance in school, different population of students, maybe adolescents and children, and the adults could mostly move online. But again, we can't just take paint everybody with one brush. You've got to look at individual students' medical background, okay, and the social networking. Because if you have a grandma in the house, if you're having a pre-existing condition, if you're you're a high schooler, or maybe it's not a good idea to just go about the same old uh, school type of thinking. So maybe you can focus on learning online. But if you're younger children and they have, again, there should be a guideline, there should be a pre-screening, and that's where the politician can help. The politician can help support the science. The politician can help develop these pre-screening based on the science. Okay, not go about, oh well, you've got to open this school for everybody or you will lose your funding. I mean, that's just really irresponsible.
Well, you're talking about let the science lead the way. Now, yesterday, Dr. Fauci stated in the press that apparently he was under general anesthesia when the CDC decided to change their guidelines and say that, people who are asymptomatic don't need to be tested. I mean, what do you think about that?
Well, I mean, let's just put the science and scientists aside and politicians aside. What the common sense tells you, okay? So if you are exposed to something, don't you want to know so you can prevent? Okay, so I think to say that you don't have to quarantine for 2 weeks or don't have to test yourself, it just really doesn't help us to get over this pandemic. It really doesn't. What's gonna destroy this country? Lack of attention to science, dragging this pandemic over and over. Because the sooner we get this under control and get over with, everybody gonna go do their work. You're gonna limit your losses and increase your gains financially, personally, physically, mentally, and so on. But I think this psychological warfare that some of these politicians are playing with this COVID-19 has really stressed out many people. I mean, you talked about PTSD and psychological health, and I tell you, this disease has taken a toll on American psyche. We have a lot of people with depression, a lot of people with PTSD, and like this gunman who killed two protesters yesterday is complete, basically psychological meltdown, and the reason for that is a lapse of judgment to the
Yes.
level of murder. And then you see online people actually support that guy and say, well, the two people you killed, they had this and that. How can you support a murderer?
Well, first off, how can you support a 17-year-old carrying a gun down the middle of the street? A 17-year-old that we won't even allow put a gun on in the military. How can you allow him to think that he's capable of policing civilians without any training whatsoever? This is such a ridiculous argument right
Have
now.
police cars and they don't do anything to him, and they shoot other people in the back. So who are from people of the color. So I think beside the um, COVID-19, which has exposed our weaknesses in teaching our kids logical thinking, being inquisitive and following the facts and science, we have also been exposed to racial divide and and also we have seen how this pandemic has impacted mental health and will continue to do that.
Yeah, let's just want to expand a little bit on that, because I think people are thinking that, well, let's say we do get this under control. I'll fake it and act like I got a crystal ball and a magic ball, and I can say, okay, all right, today we're going to get COVID-19 under control, and we're going to get the deaths down to under 100 a day. We're going to get the infection rate down to under 100 a day nationally. We're still left with a nation that is bearing the brunt of psychological meltdown, psychological trauma. And this is going to go on for a long time to come, especially when it comes to our frontline and first responders. How do we start a conversation about what's going to have to get done over the next couple of years just to bring us back to a baseline of psychological efficiency to be able to deal with tomorrow?
Sure. I mean, you and many of my friends talk about crystal ball, and I have a name for it. And the name for the crystal ball is science.
Yes.
Crystal ball. Okay, but you also ignore the crystal ball. The crystal ball of science can make this all go away. But are we paying attention to the crystal ball? No. So we are thinking that our crystal balls are political leaders, and they have many other intents with lack of understanding of science. They will lead us to death and destruction. So I think we've got to come down to that crystal ball of science. And then I think with science and technology, I mean, boy, this country is built based on science and technology. And we have, I mean, greatest nation in the world because of that. We've got to basically pay attention to science and scientists and facts that are published and debated. You know, among our own colleagues, we have colleagues who are, again, going back to hydroxychloroquine as an example, is that they wanted to debate that, hydroxychloroquine works. But the literature doesn't say that. The clinical trials are not double-blinded. They don't say that. The molecular biology of the virus, the mode of entry, is not as such that hydroxychloroquine can block it. Okay? So it's ACE2 receptor, ACE2 receptor, not endocytosis. Therefore, if your drug is working on this, something else doesn't impact the entry of this virus. And by the way, some of my, relatives back in Iran, that they actually took hydroxychloroquine and they still got infected. And unfortunately, one of them that his son graduated from a master's degree in the University of London, came to Tehran, and he threw a small party with a family of 30 people, and then hired some chef to prepare food. They all got infected with COVID-19. The father died.
Wow.
And some of the people who were taking hydroxychloroquine, thinking that it's preventive measure, they got it. And my niece, who had COVID-19 4 months before, got reinfected.
Wow.
So, I mean, if you were talking about anecdotal studies, okay, well, take this too. Okay, you can't have a doctor coming yelling on top of her lung in Washington, D.C., telling me that, she has treated 350 patients with hydroxychloroquine. They did not get COVID-19. That is just not true. It's not true because It might be true in her record, but it is not published. Publish it, that becomes a scientific truth.
And then when she published it, you'd find out that there's not probably any truth to the way she described how, you know, the oxychloroquine, what I'm sorry, the
But
chloroquine, yeah, hydroxychloroquine had any effect. Well, it was a quick question. What do you think, and maybe you can help us out, what is the real status of the COVID-19 virus? I mean, you know, vaccine. I mean, I've heard anything from the fact that there's maybe, you know, 200 to 300 of them in development, but we don't know how many of them have made it to phase 3 and how many of them are in phase 3 right now. So what is the status of a vaccine?
well, I mean, there are several of them. About 10 vaccines are being tested. Almost half of them are in phase 3 in the U.S. So around the globe. So I think the vaccine will be coming. Um, just the reason for the delay is basically feasibility, safety, and efficacy studies. Okay, these are the three things we've got to take a look at vaccine development. Is it feasible? Is it safe? It is efficacious. So these are the phases of clinical trial, and then you go from small sample of people to a larger sample to multi-central clinical trial, and then you get that data, and then you take a look at the data, take a look at the facts, fact check them, and basically price them. So again, to give you an example, our own paper took about 6-7 months put together, just looking at thousands of papers and then reviewing every paper, reading every paper, referencing it properly, and so on. So when you are trying to get a vaccine to a mass populations of billions of people, you want to make sure these vaccines are safe, okay, and you want to make sure they're effective. And those are the data that you have to go after. And then what can you tweak in the vaccine to make it more safe, more effective? Okay, because the spike proteins are mutating. So the vaccine that we have for Wuhan may not be effective for the strain 7 that's out there in the US. Okay, so there are things you can tweak in the vaccine. So you basically take the strain 7 protein and then decode it into the vaccine. So these back and forth in scientific, basically debate and scientific process will enable us to come up with a pipeline of vaccines. And as this basically virus start mutating, that's okay. It's like the flu virus. We can develop more vaccine for it. So probably we're going to have at least 1 or 2 shots per year for COVID-19. But again, if we don't educate the public about the importance of vaccine and how vaccine therapy plays a significant role in modern medicine. There are people who are skeptics of vaccines. I mean, I don't want to vaccinate myself with junk. Okay, nobody wants. Okay? So it's not like I'm for vaccine and somebody else is against vaccine. So people who are anti-vaccination, they have some legitimate concern, which I would say safety, but some misunderstanding that somehow, Bill Gates of the world, they want to just kind of vaccinate everybody, to chicken them and so on. That's not how vaccine trials are designed. When you are doing a trial for thousands of patients, you can't slip a chip in there or something. I mean, it's just kind of misinformation that is done by, I would say, even foreign adversaries. I mean, I get comments on some of my posts in my Facebook, and I dig deeper into the commentator. It turns out to be a troll.
Right. Well, so once we get a vaccine, how long do you think it will take before it'll become widely available. Let's say we get a breakthrough and all of a sudden we finish a clinical trial, a third phase trial next month. How long after the finishing of that third phase trial will the vaccine then become available?
That's a very good question. That is a policy issue. Now you see where actually science and policy kind of collide, okay, or intermingle, because developing a vaccine is a scientific process. Looking at a data and clinical trial that has to be published and be scrutinized and reproduced, that is something that science basically has to base their approval on. Now, mass scale is becoming a business and policy issue. And for us to mass scale that, you have to start talking about vaccine and educating people about vaccine. This administration doesn't do that. This administration does not advocate for vaccine, educating. How many commercials or anything you have seen about vaccine? You know, there was an anti-vax video that they were actually pushing more than vaccination. So they don't really, drive the science. They want to just hammer the scientists. So I think you've got to be prepared from now to scale up, produce needles, produce caps for needles and so on. You've got to pre-identify the vaccination sites. You've got to put the legislation into place that all the Americans are vaccinated for free. I mean, the funding for that has to be put in place. I mean, if we want to get everybody vaccinated tomorrow and we have a vaccine today, that's not possible at the moment. We have not worked our policy, financing, guideline, coordination, all of that, at least to my knowledge. I might be wrong.
I don't want to be the doomsdayer, and this is my last question. We're running out of time, and I don't want to ask you a doomsday question. However, as we look at global warming, we look at what's going on in our environment. I remember, it's about 6 months ago, even before COVID-19 started. I remember reading an article in a newspaper talking about the fact that there was a group of scientists who were researching an ice core from a that was taken out of, off a mountaintop. And that ice core was looking at ice from 100 years ago. And when they looked at the ice at 100 years ago, no, I'm sorry, 1,000,000 years ago, they discovered a version of the HP3 virus, the virus that causes cervical cancer, and recognized that that virus was different than any version of the virus in existence on the planet today. But the reason why they were looking at that ice core from 1,000,000 years ago is because the ice had melted to that place, and they just wanted to know what could possibly be in the ice that might be released. So that means that as we go through this whole global planet change with global warming, we're melting ice and releasing into the atmosphere viruses and antigens and pathogens that mankind has never seen. Never, ever, ever, our immune systems have never been introduced to. We're having a hard time right now with COVID-19. What happens when one of these things get loose? I mean, do you think we in any way, shape, or form are prepared for what we've done to this planet when it comes to, global warming and the fact that some of this stuff is getting released in the atmosphere?
Well, the short answer is no. The long answer is that we have to be prepared for more pandemic, not every 100 years, unfortunately, maybe every decade. So this is going to be around as we move into the animal territory, start eating bats and, eating animals with, different viruses. You're going to have this type of viruses jumping from animal to human, but also ancient viruses that we don't even know about. and they are very deadly and destructive, could pop up. And again, that begs the importance of funding NIH centers that discover and study this type of pathogens. So to say that NIH was funding this study, or well, there's some government conspiracy, that's nonsense. So this pathogen that you're talking about, I haven't come across that article, but if they have found that pathogen, then immediately that is transferred to CDC in Atlanta, and then immediately they will start studying on that, because if one of those guys who found it is exposed to it, then there's a possibility of pandemic. So you have got to get ahead of it. Again, our crystal ball of getting out of this is science.
Science.
We have to focus on our crystal ball. We can get out of it. And the name of that crystal ball is science. It's not politicians, not policy. But science-based policy can radiate out of that crystal ball and solve our problems.
Thank you so much, Dr. Kateb, for being with us today here on Free Thinking. And I'd love to have you back at another time. We barely just scratched the surface because we got so much that we could talk about. But I thank you, and thank you for all the hard work that you and the Brain Mapping Institute and other doctors with you are doing to make sure we at least try to get ahead of this thing. Thank you so much, sir.
Thank you very much for your time and for paying attention and highlighting the science.
Yes, sir. And for all of you out there, thanks so much for tuning in today to Free Thinking with Montel. Make sure you tune into our next edition. We're out. Thank you so much.